Ritshidze's data has the latest health report, which paints a bleak picture of Gauteng's clinics. The report highlighted uncaring attitudes, lack of treatment literacy information, and poor patient confidentiality. Now, for more on this report, I'm joined by Ndivhuwo Rambau, who is Ritshidze's project coordinator. And Ndivhuwo, thank you for your time. Sorry for butchering that introduction a little bit at the beginning there. But let's get to the meat of this report. What have you found in summary about the Gauteng Health Department?
So thank you very much. We are from Ritshidze and we conduct community-led monitoring. Ritshidze is a consortium of 5 people living with HIV organizations who go into facilities to try and understand the quality of HIV and TB services across 400 facilities across the country. And in Gauteng, we monitor specifically 126. What we found in this round of monitoring, and this also shows in the State of Health report for Gauteng, is that there's been an improvement of dismissive and rude and uncaring staff, but we are still finding quite a lot of patients indicating that staff are not always friendly and professional when they do go to the facilities. Specifically, people living with HIV report that if they happen to miss an appointment, they are often taken to the back of the queue and only attended to at the end of the day when the clinic has basically seen everyone. And issues like these really make people living with HIV to either, decide to continue and adhere on their treatment or completely disengage from care.
So, Ndivhuwo, it sounds like what you're saying is that HIV patients who skip appointments, maybe even in situations where it's completely not by their own doing, miss a taxi, get stuck in traffic, who knows, are being prejudiced by Gauteng health professionals. Is that what you're saying?
That is what I'm saying, is that we know that as people, actually, we tend to miss appointments. I might miss a doctor's appointment. I might miss an appointment with my son's school teacher. So just like anyone else, people living with HIV might miss an appointment. Maybe you don't have money to go to the clinic. Maybe you can't sort out your childcare for the day. And when patients who are living with HIV end up going back to the facility, they are not often met with care. And this really just takes away from the welcome back service that the Department of Health has put in place, where it states that people who've missed an appointment shouldn't be turned away or taken to the back of the queue, but rather they should be triaged with other streams of patients and be seen on the same day.
Thank you. So you say you've looked at 126 facilities in Gauteng. Also, in terms of this latest report, some feedback on the experiences of gay and bisexual men, people who use drugs, sex workers and trans people in terms of the kind of health care they're receiving in Gauteng facilities. What did you find?
So we found that there's actually a serious lack of key population-specific services. The accountability meetings that we've had over the past week have been very district-focused, and we're finding that there's very few facilities, or no facilities actually, who offer hormone therapy for trans people, for example. There's also very few or no facilities that offer, methadone for people who use drugs, and about 2 facilities say that they offer a referral for methadone initiation in city of Tshwane, for example. So we have cases where sex workers will go to facilities and are often discriminated against due to their line of work, and not given specific services and told that, look, you're working, so why don't you just go and see a private doctor, for example. So those are the kind of issues that key pops actually bring to the fore. There's also issues around condoms and lubricants, where specifically gay, bisexual and men who have sex with men find it hard to access lubricants in facilities because you're often questioned, what do you want to do with it? Why are you taking so many? And that's why we urge and plea facility managers and sisters to put lubricants and condoms in places where it'll be easy for not just key populations to access, but anyone to access. So this can be even in your bathrooms or places where are not too visible, that people can see you picking up condoms or whatever the case may be. Yes.
So in terms of that research and the experience of these different key population groups, is there any way forward in terms of perhaps working with healthcare professionals, working with clinics to try and conscientize healthcare workers who face many strains and challenges to deal better with the public and offer a better service?
So in our recommendations, we have put forth recommendations that indicate that any healthcare provider that might discriminate against a key population should go through disciplinary processes, and the facility manager should take lead on that, and there should be a report and an outcome on that. Also, if we are putting in place sensitization programs or trainings, key populations should also be involved in those, so that it's basically a for us bias approach. If a training is being led by a trans person, for example, you get to understand the nuances and some of the things that are discriminatory towards a trans person. The same for sex workers and PWOs as well.
You've also identified some of the challenges that come from vacancies, persistent vacancies in some of these facilities in Gauteng. Can you talk a little bit more about that? I believe the figure is amongst 25% of facilities you've surveyed, there weren't simply enough staff available.
That is true, and this was basically what we found across all 3 districts that we had community accountability meetings with. I think on average we should be sitting on plus minus 400 vacancies that are open amongst the facilities that we monitor, and some of the positions that are indicated by facility managers is like professional nurses. There's a lack of those. Enrolled nurses, in most instances, they don't have data capturers, or there's a lack of cleaning staff or even security guards. And with the high level or high numbers of open vacancies, this puts a burden on already existing healthcare practitioners in the facilities, and they become very overburdened because they have to see quite a lot of people. And this obviously will lead to burnout, it will lead to fatigue as well, and then it will also then lead to maybe a negative staff attitude towards patients. So we've also put in a plea that vacancies should be filled by the end of March latest, because some of our recommendations, we still need to go back to the different district departments and have a sit down with them so that we can talk through those timelines and how all the recommendations can be put in place.
I mean, it's quite staggering to look at some of the findings of this latest report. One person you interviewed said they went to a clinic, and while there, they heard a shout out, people for ARVs come this side. Of course, your HIV status is something which can and should be treated with confidentiality if you so choose. It's important to have dignity, respect and compassion when receiving healthcare. These are lofty ambitions, but they are so important to people's right to proper health services. What are some of the other anecdotes that stand out for you in terms of people's experience?
So, in terms of people experiences, like people who are arriving at facilities quite early, before facilities open, for example, in order to book a line in the queue. We have reports of patients even arriving as early as 4:30 to 5 to make sure that the argument is that if I get to the facility early, I will leave earlier. But we have patients who've reported that, I can arrive and start queuing in the queue at 5:30, but I'll only be seen after 2, or because I got there, my file got lost. And those are some of the things that come up, that, the files get lost, the filing systems are often messy, which then increases the waiting time. It also increases the queues. And there seems to be a lack of communication between, data capturers and the clerks, and explaining that, look, we can't find your file for now, you'll just have to wait a bit more. So those are some of the experiences from people living with HIV as well as general patients that shared with us. And we also showed these videos and showed these testimonies with the Department of Health.
Thank you. Ndivhuwo, as we close up, what is your message to the Gauteng Health Department when it comes to proper care for people living with HIV and perhaps HIV and TB?
So as Ritshidze and as the PLHIV sector, Ritshidze is not there to be a watchdog or anything. We are trying to work hand in hand with the department, with the facilities, to ensure that we build up our healthcare system. So we are looking forward to working more with the district departments of health, maybe doing some spot visits, some spot checks, so that we can see and understand what is happening in our facilities, so that we actually work together to actually build the healthcare system once again.
Ndivhuwo, thank you very much for your time and reflecting on that important work that you are doing.